Okay. It's been a little while since I've been on here. I'm going to try to get on here for the next 7 days. I'm going to start just doing a 15 to 20-minute Q&A around a subject where I'm just talking off the cuff, and if people have questions, they can ask me. And so I'll kind of try to keep my eye on that. I usually have about a 20-minute commute, and so that's why I'm kind of doing it right now. So I'm going to do this the next 7 days. For those that are, tuning in, I'm committing to about 20 minutes to half an hour of Q&A at the end of the day as I drive home. And so, if you have any questions about dentistry or implants, specifically all on four, go ahead, and this is the time you can go ahead and shoot me a question, and I can try to answer it. You can have some, a one-on-one, well, one-on-many, I guess, but I'll only take one question at a time. So if you have a question, go ahead and ask. Otherwise, my thought is I'm going to talk a little bit about something that we get a lot of questions about, and that is all on four, and specifically teeth in 24 hours. It's something that's getting more and more popular. We have a local group here that's local but also known everywhere, and they advertise a lot about teeth in 24 hours, and not just teeth in 24 hours, but teeth in permanent teeth in 24 hours. And so I want to kind of speak to that, and what that is, first of all, and why I'm not a big fan of it. So to really just kind of come out right out with it, teeth in 24 hours, there's no reason to do teeth in 24 hours, permanent teeth in 24 hours, unless you are the doctor wanting to maximize your time and increase your profits. And the reason why is because, there's lots of reasons. Let's talk about if a doctor can literally make one device, that saves him a lot in hard costs, right? If he can decrease his amount of time that he or she is working on it, that also is huge. Now he's not paying his team or his staff. And so this teeth in 24 hours really is primarily being pushed by people trying to maximize the amount of money they can get out of each patient. And so I don't believe we should spend any more time than we need to with the patient. I don't think we should spend any more money than what is required to give a great product. But if you think about it, like, why is it that some offices are doing this whole process in 4 to 6 months? Some offices like mine will do it in a week at times, being that I am the guy that's designing the teeth, or I'm the person that's going to be milling the teeth and finishing the teeth. I have so much more control than the average dentist. But even then, I wouldn't promise 24-hour teeth, permanent teeth. And so, let's see if I got any. I'm just talking from the cuff here, guys. Ask questions. I just forget to look sometimes. Looks like there's no questions yet. So, again, so let me tell you why I don't particularly like permanent teeth in 24 hours. A lot of my patients, the patients that are going to be the most, the ones that are going to want this done the most, are typically patients that have been through a lot of either bad dentistry or bad experiences, or they've neglected their teeth and put off doing this. And so the idea of getting something permanent right away, that sounds amazing, right? And I say, hold on, miss here. I've also seen this 24-hour teeth. Okay, good. All right, I'm glad you're here, my brother. Any other comments? I really appreciate it. Just want to know you guys are there. It says here, and they only charging $9K. How is that possible? Okay, so, to answer that question, Mike, that's, is this the mic? My mic? But, so, $9,000 for teeth in 24 hours. Yeah, I don't believe that's possible. That's one of the reasons why I kind of get frustrated by it, because oftentimes what I hear is that they're basically charging very similar, same price as what most doctors charge for this, but yet they're doing only one bridge, and they're basically doing it all in 24 hours. So it's kind of like a really expedited. no doubt they're hustling and busting their butt for the 24 hours. But again, let me come back to this whole idea of is 24 hours a good time frame to force artistry or have something done? Their claim, oftentimes the claim is that they're that much better than everyone else, that they can do it in 24 hours. And I think that I'm as good as anybody and maybe better than many. And the idea of doing teeth and you just don't know as a doctor. One, how is the surgery going to go? Sometimes the surgery goes really well. The bones, a lot of times we can see this from our imaging, but sometimes we can't see until we get into surgery. And then sometimes the bone can look like it's going to take an implant and really torque out and be really strong, and sometimes we don't. So when you're promising someone teeth in 24 hours and then the surgery doesn't go well, now you might be pushing the limits of what is in the patient's best interest. But because you kind of pre-framed them into this idea that they're going to have a teeth finished in 24 hours, now you have this stress or this pressure to maybe push it. Maybe in a reasonable doctor that doesn't have the stress of timeline, they would make better decisions. And so I think that's really important, is like, timeline wise, there's a lot of things you don't know. One, how surgery's going to go. Two, this is a big one I'm really passionate about. That is, if you've been hiding your smile for years and years and years, and it could be like, full on hiding, or it could be just like when you take pictures, you look a certain way. But what happens is unconsciously you keep on training your brain to smile a certain way. So you cover your if you think of your lips are like a drape, you basically are holding down the drape so people can't see them quite as well. And that's, at first that's done consciously, and then over time it's done unconsciously. So then when you finally come into an office and say, okay, I want to do all on four, even if they say smile, it's like it's so hard to get patients to be able to smile naturally. And these are the times you're taking pictures and you're putting a plan together. And so one, you can't get great imaging. Number two, you don't know what you really want. You're just excited to have some teeth that are different. And so the ideal patient that they do this on is someone that has really, really bad teeth. And so anything that they put in their mouth is going to look better than what they had. And that's what they kind of bank on as well. It's better than it was, and people will just be happy with it. But then over time, this may take years, people will start to say, gosh, maybe I rushed it. Maybe I could have had teeth that were better, And so these are the things, that's probably one of the biggest things I think of is, if you haven't had nice teeth, you don't even know what to be looking for. And so it's a lot easier to give someone one device than it is to give people two devices, because after sitting in them for 4 months, coming back, looking at them, now you can be a lot more critical. All right, I think I have some new, I promise this is all about trying to answer questions. So let me see if I can, just so you know, I am paying attention. People are going to probably say you're being dumb for driving, but I'm on autopilot. On top of that, I'm just awesome. Just kidding. No. Okay, so Mohammed said, greetings from Istanbul. Nice. Turkey. We get a lot of questions about Turkey implants. Let's see, Jenny Bo, I had all on four but removed and healed. They last 4 went the day I got my dentures. They don't fit at all where the last 4 were pulled. Okay, that's a nice comment. I appreciate that. Yeah, it's tricky. So it sounds like you're in dentures right now. Where are you? Yes, we're in Utah, Mike. So yeah, Mike, right now, as far as I'm not taking any new clients, and I like this. Some things have happened. I've had some big changes as far as my health was kind of struggling because diagnosed with some stuff where my physical health it's hard to be in a dental chair doing dentistry every day, and that kind of limits me. One of the videos in the future, I'll talk more about it. You probably saw my video I sent out, but although it wasn't something I was planning, I believe that everything that happens for a reason, and I'm making the best of it. And so part of that is getting back on YouTube and trying to really help and educate not only the patients that I have out there that still want videos, but especially these poor patients that are trying to decide and make sense of everything that's going on. And so I kind of feel that when people know that I'm not trying to get them to come, like this is the way it's always been. And Mike, you could probably attest to this. Like my videos have not been to try to get people to come see me. I mean, obviously, we hope that there are going to be patients that want to come see us. But it's always been about trying to educate first. And then it's like, if you're really educated, you're going to, if I'm the right guy, you come to me. If it's someone else, that's okay. But I'm always trying to just help people. It's really confusing. And so what's exciting about me taking a step back and not doing clinic every day and building my practice is that it allows me to speak from a place of like even more selflessness. Like I'm trying to do this because I genuinely want to help people versus, hey, come get implants from me, you know? So, you know, I appreciate those who can see that I'm a little bit different. Mike, you've always been so kind to kind of comment on that, and I appreciate that a lot. So let's see if there's, let's see here. Taylor commented, are all on four ever done well? Ooh, I like that question. So I really appreciate that because that implies a few things. Maybe some, you know, is all on four ever done well? Absolutely. There are so many great doctors that do all on four or all on X. And they put 4 to 6 implants in and then they attach a bridge within, you know, a day to a week. And then that heals as a temporary. And then you essentially will turn that into a permanent. So there are a lot of really great doctors. What I see is concerning to me is a lot of these doctors, many doctors out there are still learning. And what happens is they get good at marketing to market for them. So it gives off the impression they've done many, and reality is they don't have a lot of experience. And I really mean this from like not of a place of like shame on you, because we all start somewhere. But what I see happening, one of the biggest things I see happening is some doctors just don't know what they don't know until they make a mistake. And so this is, for example, like this whole idea around teeth in 24 hours. Like I saw like another one of my competitors just changed all their marketing. Now, well, it's difficult, even as a doctor, a really skilled doctor, to pull off something like that, right? Like I have everything in my office do that. Let's say I didn't have to sleep. It's still a challenge to do. It means everything has to come together just right. What I worry about is that if everyone starts doing this teeth in 24 hours, it's going to make it so the product or the overall outcome is worse because you're pushing to do something so expedited that things are going to get missed. I mean, that's just the reality of just life, you know? So, but there are really great doctors. And, you know, I hope that if you're looking for, you know, people that I know that are somebody, you know, close by. But let's see here. I have another question here. Let's see. Um, yeah, now I'm in neighborhoods. We got people, got little kids. I'm gonna stop here. I'm getting close to them, but let's see here. How much do all in four cost? Cost top and bottom. I've been considering it for years since all my teeth are bad. So, and it's Twisted Wicked. That's a wicked name. I like it. But so cost, you're somewhere between with before COVID, I would say you're somewhere 20 to 25 grand per arch. After COVID, I would say you're closer to from somewhere between 27, maybe 25 still in places to 35 per arch. In my office, when I was doing them earlier end of last year, um, I was right between right around 30 grand per arch, you know, and so it's a really big investment for sure. And you don't have to do top and bottom together. Some doctors really are, you know, they forget to tell patients that you can just one arch. That's the thing is it makes, you know, I was mentoring a doctor just this last week, and he mentioned that his price for upper was 25 grand, lower was 25 grand, but if they did them together, there was a discount like of $2,500. I've had that idea or thought many times, but I don't do that. It's like I don't like the idea of people being. I don't want to give them a incentive financially to like maybe rush it or get yourself in a financial problem. So I told that to him. So 25 grand, I think maybe is the average right now in the United States. And so, and if you're looking at snap indentures, is the next option below that. Let's say, okay, not all in four. Now we're talking about four implants with something snapping on. You're probably about 15 grand per arch, I'd say average. So, you know, and then below that, you know, then you start falling to a denture and maybe a two implant snap indenture or a regular denture. And so I'm happy to talk price because we often get kicked around that we don't tell people enough about pricing and stuff. And so please ask more questions if you need more details. Um, okay, so Jenny, there's a question here. Says 4 teeth remained before I got dentures. I got dentures and same day the last 4 the teeth got pulled. Swelling and healing made my dentures not fit. I'm agreeing with you saying 24 hours is not always good. Yeah, so it sounds like what you had, Jenny, was that um, you had your teeth extracted and an immediate denture made. And in order for immediate denture to really work, it takes a really good doctor and technician to make a denture that, you know, that basically can go over the wound, and then you kind of have to try to hold that in with suction. But it is really difficult. Of all the things, you know, an immediate denture is always a really big challenge for most doctors, and for patients. And that's one of the reasons why I started to do snap indentures, which is a little bit better as far as patient experience. It's still hard on the front end because you have to give some denture to heal in, but then over time, as you heal up, then the denture can be relined and it fits better. So if you're right now, you're in that phase where things aren't fitting, give it some time. Usually 4 to 6 weeks is what people need for the tissue to calm down enough so that it's not so uh, soft, so that when they go to reline it, and relining is basically there's a space that develops between the denture and the gums, and so they squirt material in there to fill in that space so that you ultimately can have uh, a better suction. You know, suction happens because there's no space, and so something intimately fits against the gums is going to heal better. But usually 4 to 6 weeks is when that is really starts to help a lot. Hopefully that answers any questions there, but I'm going to answer. See, so the Savage Cornerbread Zero said, "Hey, Dr. Hendriks, my name is Sean. I recently got snap-in dentures, and they've been great so far. What is the best way to clean my implants?" Yeah, so for snap-in dentures, there's a little bit different process than the process for either dentures or all-on-fours. So snap-in dentures, you have, okay, so in the mouth is most critical. Okay, you make sure that you are using a spin brush is what I recommend that has sharp bristles. Okay, and what you want to do is you want to clean around at 360 degrees around the implant. Really, most likely all you're seeing is the abutment. It's that metal you see on top, and so you want to clean around that, keep it as clean as possible. When you clean though, be careful as you come around the outside of the implant. Don't push too hard because that's what can cause uh, it can cause the gum tissue to drop as far as uh, the tissue will start to have recession. So don't push too hard, but you definitely want to keep it. So if it's nice, if you see that metal, sometimes it looks like gold, sometimes it has a regular metal look. You want to keep that nice and shiny. You want to see yourself in the mirror off of that. Okay, that's what you want to do in the mouth. So I like a spin brush is my favorite. Definitely don't use a regular toothbrush. You're going to be too aggressive. You're going to actually cause trauma to the gums around it. Um, People ask about you can use a water pick, but be careful. Sometimes people are just too aggressive around the outsides of the gums can be really thin, and so if you're pushing hard, sometimes that can cause trauma and it cause actual bone loss. And so you got to be careful with that. Now, the question you didn't ask that I think if I were you, I would ask would be, what about my dentures? Because those are actually where, there's a lot of money in there also. So you want to actually turn the denture over, and then you want to use that same spin brush, and you want to clean around where those implants attach into. Now, here's the thing: most important, biggest advice I'd give you is do not use any denture cleaner. Okay, denture cleaners are denture, like say the stuff you buy at Walmart or CVS. Um, they're great for regular dentures, but once you add snap indenture into the equation, The snap-in denture has either a nylon or it's like a rubber that basically is what is lining the connector from your post, and so it has to be soft. So you don't want to use anything that is a chemical on that. So when you clean inside your denture, you want to make sure that you are cleaning with just water. Um, you could use hand soap if you rinse really well afterwards. But what I've seen some patients do, which is it's really bad for the denture. That is, they just throw it in some bleach or in um, some type of chemical that seems like it'd be a good idea about killing bacteria, but consequently you're going to kill the retentiveness and the strength of those nylon caps. So I recommend you just use, just water, maybe a little bit of soap, rinse it really well. Make sure you can store it. You can store them in water. That's okay. You can store them out, but just make sure that you put them in a place that's safe, that they don't get dropped. Kids come in, grandkids come in, they knock them over. The dentures will break really easily, even the best made ones, if they hit just the right way. I hope that helps you a little about, what I recommend for snap-in denture cleaning. Oh, I'll just say one last thing about that snap-in denture too. If you don't have those retention rings traded out, like swapped out often, then the metal from the post that's in your mouth and the metal that's in your denture will actually wear against each other, and that can be very expensive, because then you have to actually change out the abutment or the post inside your mouth, and that can be, like in my office, those are usually on $500. So you really want to avoid that. There's no reason that your post on the inside would wear out unless you're waiting too long. And now something that should only be touching that nylon, right, that donut sense, that because that's what's basically locking in and out, that button. So if that wears out, now you're just metal on metal. So just be careful that you're going in regular enough to get them swapped out. Okay. Um, let's see. Broken Heart Clubs. I run a challenge. I run a challenge to share rescue dog stories on camera for that, and then work in a career where I'm in front of people having major dental implant doctors in Arizona. Yeah, I mean, there's lots of great doctors in Arizona. A group out. I want to say I would look up Dr. Farley, Dr. Kent Howell. They're both doctors. I can't remember what part of Arizona they're in, but they're both doctors that actually I've worked with. They teach other doctors as well, um, but they'd be great. Gosh, so many off the top of my head. Let me think a little bit more. If you message me, we'll drh.h@dreamdentalimplants.com. If you message me, I can send you maybe a list of 4 or 5 other doctors too, if you'd like to look at it. So, um, let's see here. Then Mike, one last thing, number 23 on the bottom arc, the screw keeps breaking. Everyone to 3 months. Any suggestions? Okay, so on the bottom, keeps breaking everyone. Yeah, Mike, you know, so I'd like to know more about that. Can you send me some pictures? Maybe send me a video. Help me hear what's going on a little bit. It's like there's a lot of things that could go through my mind. A screw can break for lots of reasons. At the most basic sense, a screw would break if the tool itself is maybe off a little bit. It would create so possibly the tool or the wrench that he's using is maybe not the right one he or she is using. It could be um, again a number of things, but I'm thinking that, again, email me what's going on, Mike, and I can take a look at it, and if you have to, can talk to the doctor too. But there's got to be something else is going on there that we have to figure out too. So, you're welcome for the advice. Josh asked, Doctor, have you heard of a Vital Europe in Hungary? Have you heard of Vital Europe in Hungary? I haven't. I haven't heard of them. There may be another dental group of sorts. I haven't heard of them. I've heard implants, and there's good and bad that it can be had for any area. But I think that ultimately, just getting the right homework on them, asking the right questions. Tourism and dentistry as a whole can be, I think it can be great. I mean, people would come to Utah all the time, was, kind of a form of local tourism, but you got to do your homework so you know kind of what you're working with. And really, it comes down to like the maintenance long term. what you can just some of these offices, they're all about just trying to get the implants in, and then they disappear, or the doctor moves to another office. And so I do think that's one of the big problems I see inside dentistry too, is just doctors that aren't interested in trying to ultimately, because anyone can make something look good for a short period of time. It takes, you know, I mean, ultimately, you're not buying that. What you're trying to buy is something that looks good, functions well, and lasts a long, long time. And believe it or not, that's not easy to do. I mean, you think about, like, we drive cars every day, and how many cars do you go through in a 20 or 30 year period? Those who take really good care of a vehicle, like my grandpa, he had one vehicle for like 50 years, but he babied it like it was his. And so, but a lot of times we just don't take really good care of things. We don't do the maintenance. And I speak for myself. This car that I'm driving right now, like, I typically don't take it in for the maintenance. I'm just always so busy. And so, but that's not an excuse, but I just know that's how we are in our mouth also. And so I think ultimately we have to just try to be very committed to taking responsibility from the time the implants are placed indefinitely on. I had some advice, and I'll give this advice to you guys. There's certain areas that you never want to delegate 100% uh, of the decision to. And I believe your medical health, like, as good as doctors are, you should still be invested doing research, multiple consults. I mean, I just believe that people can make mistakes, right? And so your health, you should be equally invested in. Your finances, I don't think you should ever trust any one person in your finances, you know? And so this is why being really educated, especially once, like Mike, you're a good example, because you're a super intelligent person. Of all the things, you are also a guy that asks the right questions, and very, very inquisitive. And that's why, like, you're thinking it from a totally different perspective. And I want all my patients to see the same way. Like, as good as I am, or as good as any doctor is, if you have a patient that's educated and that wants things to last long term also, I mean, that's the best thing you do, is educate them so that you're yoked together. Because I may come off in with a headache, or I might have a migraine, and maybe I'm not seeing things right, but if Mike's like, hey doc, this or this is, it's not looking good, does this look a little off, it can draw your attention to it, and that can actually help you. So, if your doctor doesn't like being reminded of his job or her job, then maybe it's time you find a different doctor. I definitely don't take offense to it, and I actually appreciate it. And that's why I educate, and I've been doing this for so long. I like to educate everybody. And if I had to choose between educating doctors or patients, I would take the patients every day over doctors. I just enjoy being with people that are humble by nature, and that are looking. And usually, when you have dental pain or dental problems, it does humble you. It really does. And so, I hope that this video has been good. It's getting dark. I think my wife's inside waiting for me to come in and eat some dinner. But God bless you guys tonight. I hope if you guys have other questions, please leave me a message.